Hi over the rainbow. My name is Brittany and I'm a nurse practitioner. Today I'm here to talk to you about when to take your kiddo to the urgent care versus when to take your kiddo to the emergency department. Let's start with urgent care topics. Urgent care will see kiddos who have symptoms of cold and flu. That's going to include fever, cough, body aches. We're pretty good at swabbing them, sending it off to the lab and finding out exactly what the cause is and treating it appropriately in a timely manner. We also see a lot of ear pain, inner and outer ear infections. Those are easy for us to diagnose clinically, and we offer a variety of effective treatments for those so we can get your kiddo back and going. Urinary tract infections. We also test the urine in office, so we find out very quickly if your kiddo has a urinary tract infection or not. And we send those medications over, we get them fixed up right away for you. Minor burns. So a minor burn is a burn that covers less than 5% of a body surface area. So small areas, maybe like the back of the hand, the top of the foot. We do wound care, we clean the site, and then we get them all bandaged up and fixed so they can go back home. Mild asthma and wheezing. So we can manage that in the office. We do respiratory treatments, we do oral medications, and we also have injections we can give if your kiddo's having difficulty breathing. But it's got to be mild. If it's severe, then we'll send them over to the emergency department for longer management, longer treatments with oxygen, those kind of things. Rashes. We see a variety of rashes. We have good exposure to them and we're pretty successful at treating them. So bring them by if you're uncertain and we can take a look. All right, so things that you want to bring your kiddo to the emergency department for. These are going to be fever that lasts more than 5 days. This kiddo needs long-term management. We also send kiddos who are having severe bleeding over to the emergency department. If your kid is bleeding and you can't get it to stop, that's an emergency visit. Severe burns. So a burn that covers more than 5% of the body surface area needs to be seen in the emergency department because oftentimes we need IV fluids. When we get burnt, our body loses a lot of water. So long-term management is required for those kind of things. Broken bones. So if your kiddo breaks a bone and you can see things aren't really lining up the way they're supposed to, or you see visible bone, that's an emergency department visit. Sometimes these kiddos might need to have an emergency surgery to correct that break. Seizures. If your kid is having a seizure, that is an emergency department visit. We focus on their airway, breathing, and circulation during those times. And we also need to find the underlying cause for that seizure. So an emergency department can do a lot more screening and diagnostic tools to find out what that was. So I hope you learned a few things with me, and I hope you have a wonderful day. Thanks for stopping by.